Nowadays there's a lot more electronic toys on the market, and you may see these toys geared towards really small children. It's very important that you check your toys and make sure that the cases on the back of the toys are securely fastened. Typically they're going to have a really small screw that requires use of a screwdriver to open and close the case, and this is very important because batteries that come loose, children are inevitably going to put them in their mouth, and if they swallow these batteries, most of the times luckily it will pass through the system and they'll be fine. But if it becomes lodged in the esophagus or anywhere along the GI tract, these batteries can become very, very dangerous. The batteries actually have chemicals inside of them, and so you have to monitor their electrolyte levels. You have to monitor the children for arrhythmias that could be triggered by the different chemicals, and also they may need to be emergently removed by a surgeon or through endoscopy. If these chemicals are being leached into the system, for example along the esophagus, that tissue is very delicate and it can actually burn through a chemical burn, and you can have a perforation of the tissue. Magnets are also another item that are very dangerous and are frequently found nowadays in different toys and in different calculators and other different items that can be found in the home. And the big danger with magnets is that if you have more than one magnet that becomes ingested, they can attract each other once they are passing through the intestines. And if you have different loops of bowel that have magnets in them, they can attract and pinch together, and they're so strong that they may have to be surgically removed because they will cut off the blood supply, and you can have an erosion through the tissue, and this can lead to strictures. They can actually have an intestinal blockage, and you can just imagine the complications that can be long-term from these. So please be very careful with any types of items that you may have in your home that are electronic and it may have these small button batteries or may have these small magnets. If your child happens to swallow the batteries, and if it's not going to cause a delay in seeking treatment, please try and take an example of the type that your child swallowed, because they actually have the type of chemicals listed on the back of the battery, and the ER physicians or staff can look it up to see what the child may have been exposed to.